Genesis Revolution presents Boost Your Immune System, Nutrition, Lifestyle, and COVID-19. Hi, my name is Jared Santana. I'm a board-certified internal medicine physician, and I currently work as a hospital physician. As of the development of this video, I am on the front lines of the COVID-19 pandemic. I have treated many patients with COVID and have survived it myself as well. The principal reason I'm putting together this video is because there is so much misinformation going on right now. The media continuously bombards us with the latest health fad, or there are many industries out there whose sole purpose is to make money off of your misinformation. Even when I discuss different beliefs and opinions with my fellow doctors at the hospital, the truth is not always forthcoming. What is the truth? What is scientifically proven? Does the food you eat have anything to do with your body's ability to fight off disease? Are there any other healthy habits that have been shown to help ward off infections? I'm going to try to answer some of these questions here. Please remember that although I have made every attempt to make this information credible and relevant, it is important that you always consult with your healthcare provider before attempting any type of therapy. I have divided the presentation today into 3 sections. The first section is called Introduction to Immunology, how your immune system works. I'm trying to make the topic understandable and not overly scientific. It's important to know the basics though. For example, if I mention later in the presentation about a certain activity which boosts your natural killer cell function, you need to know what a natural killer cell is. The second section is called Nutrition and Immune Function. Which foods feed a healthy immune system? Which foods cause it harm? Our bodies are complex machines. If the fuel you put in them is trash, well, you know, garbage in equals garbage out. Every single cell your body runs on has nutrients, and these nutrients fuel your white blood cells. How do you expect your body to fight off cancer, chronic disease, or COVID-19 if you have not fed them well? And the last section is called Other Lifestyle Factors that Impact Your Immune System. Here I will try and cover topics like sleep, exercise, hydration, the benefits of being outdoors, what supplements work, what do you do if you get sick, what does the scientific literature has to say on the role of faith. Thank you for joining us. Let's get started. Number 1, Introduction to Immunology, how the system works. The main function of the immune system is to prevent infections, which may be caused by a variety of organisms. These include bacteria, viruses, fungi, and other parasites. The first line of defense is the intact skin and the mucous membranes. This would also include the respiratory tract and the GI tract, which actually handles 90% of exposure to all organisms. The low pH of the stomach is a major defense mechanism, and the normal microflora of the digestive tract prevents colonization by pathogenic or disease-causing bacteria. If the microorganism breaches the first line of defense and enters the body, then the second line of defense is activated. This is called the innate arm of the immune system. This is the immediate response, but it's not specific. For example, a white blood cell goes after a bacteria that has entered to ingest and destroy it. This is the arm of the immune system that is crippled with COVID-19. Kids have a pretty strong innate response. That's probably why they aren't affected as much as adults are. The third line of defense is called the adaptive or the acquired arm. And this is specific. It takes several days for this arm to be fully functional. This is what occurs when you're exposed to microorganisms repeatedly, such as chickenpox. You may be exposed to it many times in your life, but you only get it once. To summarize, innate, non-specific, acts within minutes, no improvement after exposure. Does not have memory. Acquired, highly specific, requires several days before becoming effective. Does improve after exposure. Does have memory. White blood cells are the main ones involved in our immune response. They are found in both groups that we talked about, the innate and the acquired, and they often overlap as well. There are other cells, organs, proteins, such as interleukins, antibodies, interferon, cytokines, complements that produce an inflammatory response once the body's main defense mechanism has been breached. These are highly complex and fascinating immune responses, but we're not going to get into too much detail with those. B cells. These are acquired cells. Host defense against infections. These coat bacteria, neutralize toxins and viruses. They're involved in seasonal allergies like hay fever, autoimmunity, B cells produce antibodies that are specific. T cells, acquired. Host defense against infection, like tuberculosis, fungi, virus-infected cells. They are involved in graft and tumor rejection, and they regulate antibody response. These are the main cells affected in people with HIV and AIDS. The cytotoxic T cells also specifically kill flu viruses, infected cells, by recognizing the viral proteins on the cell surface, and then releasing a substance called perforins, which destroy the membranes of infected cells. Another cell is the macrophage. These kill microbes. They swallow them. They present antigens to T cells. They are both found in innate and acquired immunity. They produce cytokines, inflammatory markers, such as the ones listed. Natural killer cells. This is part of the innate system. These kill microbes, but primarily virus-infected cells. These can also detect the presence of cancer cells and kill tumor cells. They produce interferon and are about 5 to 10% of our white blood cells. Important. These are suppressed in COVID-19. We'll be focusing more on these. Your neutrophils are part of your innate system. They kill bacteria. The dendritic cells kill microbes. They're also in the T cells. The eosinophils, these are activated by parasitic disease, mainly worms called nematodes. Basophils, these are hypersensitivity reactions, produce inflammatory cytokines. The monocytes are the largest white blood cell. These differentiate into macrophages or dendritic cells. But we're going to focus on the relationship that these have with COVID-19. The COVID-19 infection suppresses the innate immune response. COVID-19 continues to progress and worsen if that innate response is not strong enough to tackle it. Strengthening the innate immune system, mainly your natural killers, your monocytes, may stop the viral infection from progressing, from getting worse. And this is what we want to focus on. Your main cell that you're worried about right now with COVID is your natural killer. Section 2. Nutrition and immune function. Despite our nation's ability to produce so much healthful food, fewer than 1 American adult in 5 is metabolically healthy. One of the doctors at the Friedman School of Nutrition Science and Policy at Tufts University cited a recent national report describing poor diet as now the leading cause of poor health in the United States and the cause of more than 500,000 deaths per year. The immune system needs nutrients. Poor nutrition or malnutrition is frequently a consequence of illness, and illness is commonly the result of malnutrition. Nutritional status and immunity are closely tied to one another. They're tied. Anyone who says that what we eat or don't eat does not affect our immune system is speaking purely out of ignorance. For example, our physical barriers are dependent on good nutritional status of most nutrients, especially vitamin A, which is found in carrots. This can lead to urinary and GI illnesses. Protein malnutrition can impair the body's response to the cytokine activation, which leads to severe infections. One of the examples of this is kwashiorkor syndrome in certain parts of the world. There are rapid falls in iron and zinc plasma concentrations, even before the onset of fever. Vitamin C, which protects leukocytes from oxidative damage, also decreases as a consequence of infection. This is just the icing on the cake. In this nutrition section, I will mention several of the micronutrients that influence our immune function directly, whether for good or for bad. Let me first give you a couple of definitions. Macronutrients include fats, proteins, and carbohydrates. This is where we get our calories from. I will not be discussing these significantly. We're going to focus rather on micronutrients, which include trace elements such as vitamins, minerals, phytochemicals, antioxidants, etc. Some of these are only found in plant foods. This will be the bulk of our nutrition section, but I will try and mention them briefly so you can have a generalized idea. Let's begin. Vitamin C, one of the most famous micronutrients of all. It is a potent antioxidant that can regenerate other antioxidants like vitamin E. It helps the formation of the epithelial barrier, protecting your cells against oxidative stress. It is required for movement for some of these white blood cells, your monocytes. It decreases the duration of the common cold and pneumonia. It stimulates the swallowing of these bacteria. Just remember, half a cup of broccoli has 43% of your daily value for vitamin C, and bell peppers have twice the vitamin C as oranges. Vitamin A, besides development of normal vision, it has a role in immune function, crucial for development of lymphocytes, T cells, and B cells. Spinach has beta-carotene, which is a precursor to vitamin A. Vitamin D is involved in cell proliferation of the immune cells and expressed by most of the cells in the immune system. Deficiencies in vitamin D, lead to higher susceptibility of infections due to impaired localized innate immunity. Sunshine and vitamin D, very important. Vitamin E enhances T cell mediated functions, lymphocyte proliferation, natural killer activity, production of leukotrienes. Deficiency causes the increased susceptibility to infections and can cause viruses to mutate and become more dangerous. An example of a food containing this is sunflower seeds. Vitamin B6, adequate intake is necessary for maintaining a T helper cell immune response. Folic acid helps maintain your innate immunity, like your natural killers. Selenium, essential for optimizing your immune response to both innate and acquired attacks. Antioxidants and removing damaging radicals. This is what they're good for. A deficiency of these impairs the normal phagocytosis, which is the swallowing of these white blood cells to other things that cause disease. Zinc maintains the integrity of the skin and mucous membranes. It also helps in your acquired immunity. It protects your immune cells from the damaging effects of free radicals. Chickpeas have a lot of this. Iron. Iron is involved in the regulation of cytokine production and action. It is involved in the killing of bacteria by neutrophils. Copper maintains the antioxidant balance. It has an important role in inflammatory response and innate response as well. Other bioactive compounds. Scientists have identified biologically active substances in plants that have been shown to have beneficial effects on health. For example, the cholesterol-lowering effect of phytosterols. Polyphenols have a growing interest in research due to their high antioxidant content and their role in prevention of disease. They are grouped into two classes, flavonoids and non-flavonoids. There are numerous subclasses of all of these compounds as well, and I'm just listing for you the icing on the cake for your general knowledge. I'm not going to cover too many specifics. I don't want to bore you. I've mentioned a lot of science as it is already. But without these, we would cease to exist. The flavonoids, quercetin, the other ones that you see there are found in onions, kale, leeks, broccoli, blueberries, tea, grapes, parsley, celery. I'm not naming them. You have them there on the screen. These are found in beans, lentils, chickpeas, and citrus, and fruits. A lot of them increase your production of interleukins, which help us fight disease. They increase the ability to swallow bacteria and viruses. The T cell response, decrease inflammation, increase the activity of natural killer cells. This is just naming a few. The list is way too long. Red grapes have resveratrol. This helps with lymphocyte proliferation, natural killer cell activity. Curcumin is the active ingredient found in turmeric. It was found to have mild activity against the actual SARS-CoV replication. I take usually about a quarter teaspoon every morning, and I would probably triple that under an active infection. I mean, really, what's the downside of it? Here's a few words on a few other specific foods. Mushrooms are immune boosting, and I'll show you the bibliography at the end. Kale, raw or cooked, is one of the most nutritious foods on the planet. Broccoli and other cruciferous vegetables are very nutritious. They carry a lot of this stuff. Berries boost your natural killer activity. Black tea was shown in some studies to have anti-coronavirus activity. I prefer decaf, but I've included some of the slides, some of the sources for you to find them out on your own. I personally would also recommend increasing your intake of garlic and ginger as well. Well, I'm going to slow down for a moment. I threw a lot at you in a very short time just now, and maybe some of it was difficult to understand. The great thing about technology is that you can rewind it if there was something you missed, or forward it if it was just too plain boring. I wanted to bring the point across about just how important diet is to having an optimal immune system. Seeing as how we're experiencing a pandemic with the coronavirus 19, how is this relevant to us right now? Luckily for us, there's plenty of research on the subject of the antiviral activity of phytochemicals. And this mechanism includes the antioxidant effect, which we saw some of, the synthesis of DNA and RNA, and the blocking of viral reproduction, which is what we want. Okay? One quick note on obesity and immune function. Individuals with higher BMIs have increased susceptibility to infections. These include respiratory illnesses such as pneumonia. Overweight children have twice the rate of respiratory illness as well. The good news for these kids is that after they lose weight, they were found to have an increased T-cell response, decreased oxidative stress, and increased natural killer cell production. So yes, a good healthy weight is important. So what are we eating now, and is it affecting us? Realistically speaking, we Americans eat way too many foods that aren't good for us. After all, we are what we eat. Look at this food graph from the USDA Economic Research Service. Look at the percentage of processed food we take in every day. Just look at it for a few minutes. Ladies and gentlemen, we don't have a toilet paper deficiency like in early COVID. We have a major nutrient deficiency. Let's discuss for a moment one of America's favorite fast food combos, the burger and fries. As of 2019, it was actually a chicken-selling fast food chain that dominated the market, and you've probably eaten there before or have heard about it. You can figure out the name. I'm not interested in dealing with backlash from the meat industry. If you're really interested in the big why we eat the way that we do, get on Netflix or Amazon and watch What the Health or The Meat Lobby. For the sake of simplicity, let's look at the burger. It can be beef or chicken, you pick. Look at this image of the hamburger. It has a burger bun, which is essentially refined white flour along with oil and sugar. Processed meat and cheese, which is loaded with saturated fat and cholesterol. And it's usually accompanied by processed mayonnaise and ketchup, as well as some fried French fries and a high sugary soft drink. The healthy stuff is the tomato, onion, and green lettuce. So how many antioxidants do you really expect to get from a burger? Actually, since I'm exposed to COVID on a regular basis, this is the last thing I want to eat. The National Cancer Institute on the status of the American diet says that 3 out of 4 Americans don't eat a single piece of fruit in a given day. 9 out of 10 don't eat the recommended daily intake of vegetables, and 99% don't reach the minimum of whole grains a day. Like Dr. Michael Greger put it, according to the federal guidelines, we could be eating a quarter of our calories from cotton candy and soda, and we would still be within the norm. As of the production of this video, in 2020, COVID is still here. No one really knows when and if it will hit hard again, but I'm going to venture and say we're not out of the woods yet. To conclude this section on nutrition and immune function, eat way more plants. Eat less of the other stuff, period. If you don't want to give up the other stuff, that's an individual decision. I personally eat a whole food plant-based diet. It floods my body with the micronutrients I need to stay in optimum condition. I don't have a choice. Most people don't enter a COVID-19 positive patient's room to listen to their lungs. I do. The third section, lifestyle factors that impact your immune function. The outdoors, mainly sunlight and fresh air. Decreased sun exposure equals decreased vitamin D production, which we know decreases your immune response. With every breath you take, you inhale thousands of tiny bacteria and other microorganisms. That can be dramatically reduced by breathing fresh air as opposed to stale indoor air, which most of us breathe daily in our workplace. I don't think I have to get into the negative effects of air pollution. We all know about that. Water. A dehydrated body is a sick body. Water is necessary for just about every bodily function known, and immune function is no exception. Perhaps it comes as a surprise that carbonated soft drinks are the most common consumed beverages, with an average of 44.7 gallons consumed per person per year. Rounding out the top three is bottled water at 28.3 gallons and beer at 20.8 gallons. Unfortunately, water should be number one. Exercise. Approximately 95% of all infections start in the mucosal surfaces, the eyes, nose, and mouth. These surfaces are protected by IgA antibodies, which neutralize and paralyze entering viruses like influenza and other illnesses like pneumonia. According to the research, those who exercised for 30 minutes 3 times a week had a 50% increase in their IgA levels and reported significantly less respiratory infections. Of note, strenuous athletic activity actually had the opposite effect. Runners who do strenuous activity were given 1 teaspoon of nutritional yeast per day, and they cut their infection rates in half and reported to feel more vigorous. So there's a little tip in case you like to do vigorous exercise. Sleep. Dr. Chris Winter is known as the sleep whisperer. He is a neurologist with many professional athletes as his patients. In his book, The Sleep Solution, he talks about the effects of sleep in your immune system. He mentions 2 groups of subjects who were purposefully exposed to the rhinovirus, which is a common cold virus. Coronavirus also causes the common cold, by the way. Subjects sleeping 6 hours or less develop the cold more often than those sleeping more than 7 hours. You know you've been there on finals week or working multiple night shifts somewhere. Poor sleep equals poor immune function. By the way, did you also know that poor sleep can lead to the development of autoimmune disorders like rheumatoid arthritis, lupus, or Sjogren's syndrome? Here's some advice for children and for us older people as well. One of the most common reasons I get paged at the hospital is from a nurse asking for a fever reducer for a patient. I'm really not sure where this practice originated, but my wife is a pediatric nurse and it's no different in the world of children. It seems to me that no nurse wants to run their risk of their little patients having a seizure from the fever. But the truth is, the American Academy of Pediatrics advises against reducing a fever. Appropriate counseling on the management of fever begins by helping parents understand that fever, in and of itself, is not known to endanger a generally healthy child. In contrast, fever may actually be of benefit. Thus, the real goal of antipyretic therapy is not simply to normalize body temperature, but to improve the overall comfort and well-being of the child. I personally don't reduce a fever unless it's greater than 103. The last times I ran a fever, including having COVID a few months ago, I did not treat it. I didn't treat it in my kids either. And after a few hours, it's gone. A fever is important in fighting an infection. Here are a few more tips in case your kids get sick. Just remember, green or yellow phlegm does not necessarily mean your child has a bacterial infection. Viruses can cause it too, and these do not need antibiotics. Second, don't overdo the fluids. It is important that your kids stay well hydrated, but you don't have to go overboard. It may actually be a bad thing. For the current COVID pandemic, as of now, we are using very conservative fluid management. Number 3, if your child is really uncomfortable with the fever or body aches and cannot sleep, a little bit of ibuprofen and some food may be of benefit. Number 4, reduce intake of difficult to digest foods such as meat, dairy, avoid sugar, and vegetables should be plain or in soups, and that would be of some benefit. Number 5, seek medical attention if rapid breathing or wheezing, grunting, labored breathing, abdominal pain, change in mental status or behavior, persistent nausea or diarrhea, or unable to hold sufficient fluids down, persistent fever above 103 for 3 days, call your doctor. Is there a role for hydrotherapy? Let me tell you about this. The influenza pandemic of 1918 killed 675,000 Americans and 50 million people worldwide. A few sanitariums at that time treated their patients with hydrotherapy, and these were the results that they noted. Pneumonia with standard care versus hydrotherapy, 16 versus 2.4 patients. And the death toll with standard care was 6.7% versus 1.3%. That was reported with the use of hydrotherapy. Your innate immunity can be strengthened by manipulating external heat and cold applied to the body. Heating and cooling seems to increase markers of innate immunity, such as natural killer cells and macrophages. So check that out. Just Google hydrotherapy for infections. And the last one, trust in God or in a higher power. What I have attempted to do in this talk is give you evidence on what the scientific literature has to say. This last section is no different. Whether or not you believe in God, belief in Him, or in a perceived higher power has proven improved outcomes. While there are no scientific studies to prove or disprove the existence of God for obvious reasons, there are more than 3,000 studies that find a positive association between religion and health. People with religious backgrounds, not just Christians, are less likely to develop depression, attempt suicide, or have problems with substance abuse. They have an enhanced well-being and larger support system. They tend to have better health and immune function. That's what we're talking about here. They have less heart attacks, strokes, lower blood pressure. They have improved longevity. To close this webinar, here's a summary of what you can do if you are diagnosed with COVID-19 or just decrease your risk of developing a severe infection. Number 1, eat tons of fruits and vegetables, along with legumes, which are your beans, and whole grains. Decrease your consumption of animal products, including meat, cheese, dairy, and eggs. I'm not saying you have to eliminate it, just decrease it. Decrease refined sugars and processed foods. Stop smoking and vaping. COVID is going to attack your respiratory system. This should be clear. Sleep 7+ hours per night. Exercise 30 minutes per day to prevent. You got to rest when you're sick. Drink enough water to stay hydrated, but don't overdo it when you have COVID. Get outdoors. You need sunlight and fresh air, so you have less inhaled microbes. Try the hot-cold therapy. People have done it for centuries. It worked well in 1918 for the flu. Less mortality. It could save your life. What have you got to lose? Just ask your doctor first. And the last one is pray or meditate. This concludes this webinar on boosting your immune function with nutrition and lifestyle and coronavirus. My name is Jared Santana. I am an internal medicine specialist. You can read my full bio on my website, genesisrevolution.com. I go into a lot more detail on my online lifestyle seminars. My ultimate goal is to make you healthier. Thank you so much for watching.